Hello, my name is Christina, and today I would like to talk to you about Polycystic Ovarian Syndrome, otherwise known as PCOS. When I was first diagnosed with PCOS, I was 20 years old. I didn't know anything about it, and the doctor knew little more than I did. She didn't point me in any particular direction, just tried to explain that I had cysts on my ovaries and that it would affect different areas of my life. I never realized how much of my life it would actually affect. PCOS affects 1 in 10 women worldwide. It is estimated that 70% of women are undiagnosed. However, PCOS manifests itself in lifelong changes of your body. Some of the symptoms of PCOS include lack of periods and ovulation, infertility, increased blood levels of androgens, which is a male hormone, excessive hair growth and acne, obesity and weight gain, insulin resistance, high blood pressure, and dark patches in the skin. Unfortunately, right now there is no cure for polycystic ovarian syndrome. However, there are treatments that you can use depending on what symptoms you are trying to treat to make your life more comfortable. You can take birth control pills to control the lack of menstruation or overmenstruation. It also controls the hirsutism, the male pattern hair growth, and the acne. You can take insulin sensitizers such as metformin, which is a glucophage that's not currently approved for use for PCOS in the United States. However, it is approved for diabetics, and a lot of women who have PCOS end up with type 2 diabetes. Another thing you can do is change your diet and include exercise. Unfortunately, for most people, changing your diet just means eating a little healthier and a little less. But for people with polycystic ovarian syndrome, it's a little more complicated. First, you have to take out all simple carbohydrates, such as white sugar and white pastas and breads. Eating whole grain is definitely an option, but many people with polycystic ovarian syndrome benefit from a low carbohydrate diet all the way around. If you have polycystic ovarian syndrome, you probably feel alone. I know I did once it finally hit me with all of the symptoms that I was having. It defined my whole life. Unfortunately, it also caused me to be infertile. I currently do not ovulate. PCOS can be a very emotional journey. You don't really know what you're getting into because there's no awareness. If a doctor were to look at you and say you have cancer, you will have a lot of thoughts going through your mind, but you certainly know what it means. You know what cancer is. Polycystic ovarian syndrome is not the same way. When I was diagnosed with it, I had never heard of it, and nobody around me had either. I found out years later that a family member of mine was also suffering from PCOS. She had been trying to get pregnant for over 10 years and yet have not been successful yet. Unfortunately, I hope that my journey does not go in this direction, but I also know that it is a chance. Right now, I take metformin, the glucophage, to help with weight loss, insulin resistance, and hopefully so I will ovulate one day. If you have polycystic ovarian syndrome, understand that you are not alone. This is a disease that people don't like to talk about, but we need to raise more awareness about it so that women in our age bracket can know what's going on with their body and how to best treat it. If you are concerned that you might have polycystic ovarian syndrome, the best thing to do is go to your doctor. I've also included the sites that I've sourced below so that you can look at any more information and hopefully get a well-rounded perspective of what polycystic ovarian syndrome is. Please share this video with all of your friends and family who might be sufferers or who might need to be educated. The hardest part of it is certainly the infertility, but it also is hard to have excessive hair growth and acne and dark patches on your skin. I suffer from all of these things, and it is embarrassing, but these things will pass, hopefully with time. To those who are suffering with polycystic ovarian syndrome, I say good luck to you, and I say please talk to your doctor and follow up and make sure that you are getting the proper care. If your doctor makes you uncomfortable or doesn't know what it is, I suggest going to an endocrine specialist who should be able to assist you better in your next move. Thank you for watching.